Hey everybody, this is Rob Smith at The Body Project, and I am deep in the trenches today. And we are working with Bjorn. Say hi, Bjorn.
Hi.
So, some of you guys might remember we've done a couple of videos with Bjorn. Bjorn's had how many surgeries now?
Over 10 surgeries.
Over 10 surgeries. So just a recap. Tell me your story. You were born.
Yeah, I was born with clubfoot, and I've had 2 different leg lengthening surgeries and all sorts of other just associated surgeries. So I have a lot of scar tissue and scars just as a result.
Yeah, so one of the things, if we take a look at the holistic model and we take a look at any symptom, say a person's experiencing pain, what one of the variables is obviously is the structural component. So we know, because Bjorn's had multiple surgeries, there's clearly a structural component. Now, in terms of the pain and the dysfunction and inability to heal, we have to look at the other variables. And so today what we're addressing with Bjorn is his scars. And Bjorn has I don't know how many scars we have here total, but scars actually can create electrical disruption. And so what happens is, if you think of a nerve pathway like a hose, and you think of a scar as something that would kink the hose, so that decreases electrical innervation to this particular muscle, so the muscle starts to weaken. But another thing too is scars can create a lot of havoc with your autonomic nervous system. So what happens is, because 80% of your sympathetic fibers, which is your fight or flight, are on the skin surface, a scar will actually keep you in that sympathetic tone. And so it's very, very difficult. In fact, it's impossible to heal when we have a high sympathetic tone. Remember, we want to be rest and digest. And so that parasympathetic tone. So I want you to picture this. Think of a healthy cell, okay? Think of a healthy cell like a grape. And when there's an injury, or you have dysfunction or weakened tissue in an organ, a gland, or in this particular case, a joint, what happens is that cell that's like a nice grape turns into a raisin. Why? Because it loses its electrical charge. And so what we're doing right now is we're using a technique called frequency-specific microcurrent. So what we're trying to do is we're trying to take this raisin, i.e. the dysfunctional tissue or the scar, we're trying to plump that up back into a grape. And what we're trying to do is reestablish flow. Because when we have scars, it creates blockages. And so if you take a look at when I'm working on Bjorn in this dysfunctional area, in this area of scars, I've got the unit up as high as it will go. Now if I get off of this area, it's pretty tender, pretty painful.
Yeah, I feel those jolts.
It's and he's got a pretty high pain threshold. But what that means is, you can see he's jumping a little bit. So when I get back into that really, really restricted area, then what happens is it requires more of an energy push to break through that scar tissue. So he can tolerate a lot more when I'm in the dysfunctional tissue, because he needs that high energy push. So when we get off into an area of healthy tissue, it's too much. It's too much electrical current. And remember, our bodies are bioelectrical. And so what happens is anytime we have damaged tissue, anytime we have dysfunction of any kind with a gland or an organ, what happens is the cells start to lose their electrical charge. So what's important is we determine what the symptom is, and then here's all the variables we have to look at. So Bjorn said, based on the imaging, he had a lot of arthritis in the joint. So one of the things is with Bjorn, if he would eat foods that would create inflammation in his body, i.e. sugar, not that he would ever eat sugar, but it could be sugar, dairy, wheat, any irritating foods or any foods that could potentially create systemic inflammation in his body will settle right into the weakened tissue, and in this case, it's right here in this joint. So one of the things we want to do, when we think of this area, it's like a swamp. It's blockage. What we want to do is we want to take this swamp and turn it into a beautiful mountain stream. Wouldn't you like that? Beautiful mountain stream? So it reestablishes flow. So we can use something like a frequency-specific microcurrent. I'm going to have you flip over on your stomach, and you can take a look at, let's get a shot of this, Mary. So we can see the deep scars we have, and what I can do is now, using a tool, we're gonna do gua sha. So what I'm gonna do is I'm actually going to create an irritation here. So the body will look at what I'm gonna do as an injury. So if you can see, let's get a close up here. You can see this scar, it just doesn't have a lot of blood flow, so it's hard to heal. Now what I'm gonna do is I'm gonna create this irritation in here, and Bjorn loves this, by the way, and you can start to see, we'll get some color in that scar. You can see right here, they're starting to get some blood flow into the area. And by doing that, we can start to break up that scar tissue and normalize the electrical charge of that cell. You can see how nice and colored we have that now. So, one of the things we definitely always want to make sure we do when someone has an injury is we want to restore the functionality back to this area the best we can. So with Bjorn, in order to really optimize this area, we have to continue to break down that scar tissue. And so what we'll do here is we'll do some manual work. We'll use a tool such as this. We'll use microcurrent, anything to restore the positive electrical charge back into an injured or dysfunctional area. And so just think of this, if you've got any type of injury, what happens is that particular site at the cellular level will start to lose its electrical charge. And in order to actually get out of pain and fix the problem, what we have to do is reestablish flow and reestablish normal electrical charges. So if you know a friend or family member or yourself, you're struggling with pain or an injury, just remember, you have to get that flow restored. You have to raise the electrical charge. So if you learned anything from this video, please go ahead and like the video. If you got a friend or family member who might be able to benefit from the information, please share it. And if there's anything we can possibly do to help you, give us a call. And so I will see you tomorrow. I've got a couple more things planned I want to share with you in terms of energy. Like Einstein said, everything is energy. And so that's what we're going to be talking about tomorrow. So until I see you tomorrow, go ahead and make it a great day. You certainly deserve it. And we'll see you tomorrow.